Okay. Good morning. I have the honor and pleasure of serving as President and CEO of the Pennsylvania Association of Community Health Centers. My name is Sherry Reinhardt. Our health centers are one of Pennsylvania's great resources. Federally qualified health centers, also known as community health centers or FQHCs, serve about 1 million people across Pennsylvania and 31 million people across the United States. We have over 400 locations in 54 of our 67 counties. FQHCs have been around for over 50 years, but a lot of people don't know about us, and that's a shame because more people could benefit from receiving their health care at a community health center. The FQHC model of care is a unique one. And I'm just going to quickly explain that using the FQHC as a mnemonic. The F is fees based on ability to pay. Every community health center will offer a sliding fee scale to anyone whose income is at 200% of poverty or below. The Q is quality health care for all, with the emphasis on quality and all. Every community health center in Pennsylvania and in the country contributes data to what's called the Uniform Data System, or UDS. It is publicly available and publicly available by individual health center. So you can see how your local community health center is doing clinically, financially, and the demographics that they serve. The H is highly competent health professional team. We know that many, if not most, of the patients we serve are challenged by the social determinants of health, like poverty. Frankly, that they're challenged by life often. And so we try to remove as many barriers as we can. One way to do that is to be a one-stop healthcare home where they can get not only medical care, but they can get dental care, they can get behavioral health care, and they can get other health-enhancing services. The thing that really distinguishes FQHCs is the C, and that's community/consumer control. Every FQHC in Pennsylvania and in the country must have a governing board that is at least 51% patients served by the community health center, and that's to keep us true to the communities that we serve. Our health centers provide care to, as I said, over 1 million people. And that care is helping people get well and stay well and out of the hospital and needing much more expensive emergency and hospital care. The Federal Government Accounting Office, the GAO, recently showed that health center investments in health centers actually results in savings, not a cost, net cost. I have some esteemed colleagues and legislators with me today that are also going to talk about some of the other things that are important to our community health centers. With that, I'm going to turn the mic over to Representative Gens.
Yeah. Thank you. Let me just bring this down to short level. Ladies and gentlemen, good morning, and thank you for joining us today. I'm here to discuss the need for full practice authority legislation across Pennsylvania. This initiative is a vital step towards addressing the healthcare challenges our residents face daily. Full practice authority has proven itself as a solution to many of these challenges, and it's not an untested theory. It's already successfully operating in 27 other states and within the VA system. This legislation would empower nurse practitioners to serve both rural and urban areas, bridging the gap in healthcare accessibility for those who currently lack adequate access to quality care. The importance of this cannot be overstated. It's about ensuring all patients receive the top-tier care they deserve, regardless of their geographic location. Pennsylvania is currently experiencing the loss of nurse practitioners, a trend that's impacting not only border counties, but the entire Commonwealth. These NPs are essential in delivering timely and high-quality health care, and retaining them within our state is crucial. By eliminating the costly collaborative agreements currently required, this legislation would enable NPs to open their own practice, offering a tangible solution to the shortage of primary care providers statewide. Whoa! Yes, thank you.
Teamwork.
Okay. That was fun. This is common sense legislation supported by the overwhelming majority of Pennsylvanians. As we face shortages of physicians and grapple with the mental health crisis, the urgency to pass this legislation cannot be overstated. Let's remove the unnecessary barriers, support our healthcare workforce, and fulfill our duty to ensure every Pennsylvanian receives the health care they need when they need it. This legislation is not just common sense, it's a vital necessity. Thank you.
Me? Am I good? Okay, all right. Thank you, Representative Gentz. My name is Tara Khan, State Representative. I represent Lower Northwest Philadelphia. And welcome to our community health centers.
Yes.
So I am very proud to say that I work at a community health center. I work at Abbotsford Falls. In addition to the fact that, yes, I am a legislator, I work every Friday morning. And I want to just take a moment just to thank Representative Gentz for her comments about full practice authority, because our health center is actually a nurse practitioner run facility. And that's a type of personal care that people get at FQHCs. I have to just say that I was so overwhelmed when I interviewed 10 years ago to work at Abbotsford Falls Health Center, because this is exactly what I wanted. I wanted to serve people who had been marginalized, who often were forgotten about, people who didn't have access to quality health care. And I saw that this was a family at Abbotsford Falls, as a place that as an employee you were valued, and that it was really centered on the patient, making sure that people had the care that they needed. And it wasn't just primary care, although it was excellent primary care, but they also had a dentist there. It was really head to toe service. They had behavioral health counselors, and they had nurse practitioners that were behavioral health specialists, that were behavioral health specialists, that were psychiatric specialists. We had cardiologists that came once a month. We had a foot doctor that came twice a week. We had physical therapy in the facility. And it was a place that you knew that if you needed quality health care, you could go. They even had a 340B pharmacy where you could get your medications. And it's these types of places that we need to be investing in. And the health centers are here today with three very basic and very fair asks. The first one, I think, is a very minimal ask, and it's a $10 million ask. It's a line item in the budget for community health centers. And while $10 million might seem like a lot of money, in the scope of a $46 billion budget, it really is pocket change. And I think this is the least that we should be doing for our community health centers. And let me also just highlight the fact that Pennsylvania is only one of 3 states that don't already have this as a line item for their health centers. This is the least that we can do for our most vulnerable residents, a $10 million line item budget. The second is these 340B health centers, these 340B pharmacies, which are really the lifeblood of these health centers, because these allow patients to get access to medication. You hear so many stories of patients not being able to afford their medications. Well, I know that our 340B health center is called Right Choice, and I know when a patient goes to Right Choice that they're going to get their medication, and they're going to pay the least amount of any other place. And not only that, it helps the health center because of the rebates and the discounts. It actually helps the health center. And in many cases, this is the reason why our health centers are able to offer those opioid treatment services, those mental health services, those maternal health services, because of the 340B program. So we have to make sure that we are protecting the 340B program and supporting it, and making sure that this is not going to get cut and they're not going to be further restricted. And finally, they're asking to restore funding to the primary health care, to restore funding to the primary health care loan forgiveness for the Department of Health to $2.8 million. So this is restoring money to the primary health care loan forgiveness program to bring that number to about $8 million or $8.5 million, because we need to be investing in our workforce and making sure that our healthcare providers are going to practice at federally qualified health centers here in Pennsylvania. I just want to say one last thing, is that it really has been the highlight of my nursing career to work at a federally qualified health center. These places are really where people can go and be taken care of, and they know that they're going to get high quality healthcare services. And at a time when so many people are struggling with paying for their medication, finding out how they're going to afford their health care. By the way, I don't think I've ever heard a patient getting a bill from Abbotsford Falls Health Center because they wanted payment. They work with people where they're at, and I think that is commendable, and we need to be investing in these health centers. So that's it. Please support our federally qualified health centers. Please support our community health centers. When, like Nancy again says, when nurses are asking, we have to listen to them. And this is what we're asking for. So thank you very much. Thank you.
Well, thank you so much, Representative. I don't know what else there is to say. I don't know how you could say that better. My name is Rich Reinhardt. I am the Chief Executive of Cornerstone Care, which is a federally qualified health center in southwestern Pennsylvania. We have 14 locations across 4 counties. Our service area has some of the most rural communities in Pennsylvania and the country, and we cross small towns, and we are also in urban areas. I'm here today just to simply attest to these things that community health centers do on behalf of my colleagues behind me and the 5,300 people who work in community health centers across the state. Those are the doctors, the dentists, the nurse practitioners, the nurses, the chiropractors, the psychiatrists, the counselors, and many others, and all of the support staff, the dental assistants, medical assistants, every day come to work to take care of over 1 million people that otherwise would not have access to high quality, affordable primary health care. You've heard the data about the money that we save. What is just incalculable is the impact that we have on the lives of our patients. Cornerstone Care saw its first patient. A nurse practitioner saw our first patient 46 years ago in a house that was a coal superintendent's house on the banks of the Monongahela River in extreme southwestern Pennsylvania. And that was because a group of citizens came together in that community to address a very important need that they had, which is getting access to a doctor and dentist. And over the years we have grown. We've served now 21,000 patients. You heard Sherry talk about the savings that community health centers give, and these are documented by government studies. I can tell you that if you do those calculations, just Cornerstone Care, one of 54 community health centers across the Commonwealth, we're saving at least $35 million per year in Medicare and Medicaid payments because we keep people out of the hospital and out of the emergency room and more healthy. And just on that note alone, I think the ask of $10 million in the state budget is a tremendous return on investment. We've struggled here in the recent times with not having quite enough resources to cover the demand. Workforce issues are a challenge. So these asks, we think, are fairly modest to keep our doors open. altogether across the country, community health centers are saving $1.6 billion. You know, one of the things that kind of drives me crazy is that I know people will literally drive by one of our health centers for years, even decades. And then they'll come in, hopefully they'll come to us before the emergency room, and we'll find out they haven't seen a doctor for 40 years. And why? Why is that? Because they don't trust the system oftentimes, and mostly they're afraid of what the cost is going to be. Community health centers make that cost affordable. I know the governor is rightly focused on medical debt. I would just like to say that community health centers do a big job in keeping people from incurring that debt. So the idea of some support in the budget, I think, is one that should be seriously considered. We are also, because of the shortages in providers, would really like to have our nurse practitioners be a little bit freer, and the ask for that, I think, is reasonable. And then, you know, if we could just solve this problem where the manufacturers of the pharmaceuticals, and the pharmaceutical benefit managers are kind of squeezing the resources out of this 340B program. We just need some protection there. So with that, I thank you for your attention and turn it back.
As you've heard reiterated several times, the ask is a modest one for what health centers do and how much of an impact they have on the health and well-being of the Commonwealth. Investing in community health centers means an investment in you. I will say that I think we should bring our press event to a close, or several people here will probably need a community health center for heat stroke. But if we have members of the press who have questions, any of our health centers are happy to discuss that with you. Thank you.
Oh, yeah. Jamie, can we get a photo?
Okay, 4 of us. Sure.